Well, it's just barely afternoon.
Good. Well, how's everybody doing?
Good.
We were hoping you might join us.
Well, it would probably be a good idea for us to, I think. Anyway, we're here. We will go ahead. Mandy, are you on with us yet?
Yes. Yeah.
Okay. Well, we will officially declare the meeting open, and Mandy is going to give us our invitation.
Dear God, we are so thankful for you and all that you do for each and every one of us. Lord, I ask that you continue to guide us through these tough times in the valley, Lord, and help us make the decisions we need to make as leaders, as family members, as just people in the community. Just be with us and guide us as we move forward each day, as we know that you are in charge. I ask that you be with every Rotarian here, our families, and just help us to be strong and give us the wisdom we need to carry out your will. In your name we pray. Amen.
Amen.
Thank you, Mandy. And Dave, can you put the flag up, please? Okay, the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America
and to the
and to the
republic
republic for which it stands,
one
one
nation
nation, under God, indivisible, liberty and justice for all.
Thank you. Now, on announcements. We do have a really good, what I think is going to be a really good program today, and we've got some more lined up for next week and the week after. We also are going to host a wine tasting that David Leonetti is helping us put together. It's going to be on the 28th of August, and all you have to do is sign up and let us know that you want to participate. And the deadline for getting signed up so that we'll have time to collect the wine and distribute it will be the 20th of August. So if you have any interest in that, we encourage you to participate with us and join us on that. We'll give you more detail on to exactly how to get signed up and indicate your wishes a little bit later on. In the meantime, our program today is going to be Julie Packer, and she is going to be introduced by Ingrid. So Ingrid, would you please go ahead?
Thanks, Lou. I'm happy to introduce Julie. All of you know Julie, of course. We were really fortunate a couple weeks ago to get an inside scoop from our Rotarian Gerald Ferguson. And so after that, I was talking with my programs committee, and Julie happens to be on that. And I found out that she actually had experienced a mild case of COVID as well, and that she would be willing to share her experience with coping and going through that and dealing with that disease. So she's going to give us some guidelines about what her symptoms were and what she did, how she was able to go get tested, about what it's like to go through self-isolation, and also her dealings with the Catawba County Health Department as well. So it's my pleasure to introduce Julie Packer.
Thank you.
Thank you. Hi, everyone. Good afternoon.
Hey, Julie.
While we were embarking on these first meetings together, I was sitting here recovering at home. So I was on Zoom with you, but recovering at the same time. I just want to give you some insight into my experience and hope that you don't have to go through it. But if you do, to give you a little bit of comfort and knowing you can manage it and it can happen at home. And 81% of us across the world have only a mild case. We've had it compared to influenza, but it's different. So I wanted to kind of touch on a few things. And as of today, I don't know how many of you get the paper or get the daily updates for the dashboard. in North Carolina today, as of today, 114,338 cases of COVID-19 have been recorded. And of those, 1,767 have been from Catawba County. 24 total deaths from our county, and today, right now as I speak, there are 19 patients hospitalized in our local hospitals. And 1,241 of our cases have recovered, and I'm one of them. So, and is Gerald, so I'm pleased to report that too. So 81% of our cases across the world are mild. 14% are classified as moderate, or some people say severe. And mild, I like to say we recover at home. Your severe, 14% may be those who go to the hospital but don't have to go to the intensive care unit. And only 5% of cases are critical. And that seems to be where we've seen the most publicity in the media. You know, it is tragic. Some of those cases have just been very hard, and I know that we heard about that from our nurse who was in New York. But most cases are manageable, and it's very comforting. So I wanted to give you a flashback to May on our timeline. Let me just put this in context. Give you a little report about my experience, and then I'm going to touch on testing, symptoms, self-isolation, some tools. Flashback to May, if you recall, Friday, May 22nd was Ray Cooper's opening up North Carolina to the beginning of phase 2. And that kind of set the wheels into motion with our population getting excited about Memorial Day, Monday, May 25th, the following Monday, kind of getting back to what we hoped would be a normal kind of more normal situation. If you flash back one prior week to that, Friday, May 15th, my husband, Jim, was in his office, and one of his coworkers approached him at his door. At that point, they were not in his office suites wearing masks because they were each isolated within their own offices. And this gentleman asked Jim a question. Jim needed to pull the information up on the computer. The man proceeded into the office kind of nonchalantly and formally, came behind his back to look at my husband's screen. And in that moment of or a few moments of looking at that information over Jim's shoulder, probably projected some droplets into the air. The following Monday, which was the 18th of May, prior to us going into phase 2, this gentleman called Jim and said he had been symptomatic over the weekend, had gotten excited, gone to Walmart, didn't wear his mask, bought some things for Memorial Day weekend, and he becomes symptomatic, not necessarily getting it that weekend, but symptomatic that weekend, and reported that to Jim, which was good because he then put himself on self-isolation from work. But that put the flag up at home here, and that was on Monday. And Thursday, before that Friday of reopening phase 2, Jim spiked a fever, became symptomatic with a dry cough, and I said, okay, upstairs, buddy. So he went into what we call self-isolation. Fortunately, we have no kids at home right now, a guest suite upstairs with a bathroom connected to a bonus room, so he was able to kind of take over the upstairs. And what we found is, even so, that following Thursday, May 22nd, he became symptomatic, self-isolated. So that following day, we went for testing. My first initial response was to call the closest urgent care around the corner from our neighborhood. And they do testing there. That's the Catawba Valley Urgent Care right next to Da Vinci's. And they said, you know, rather than you coming here and having to wait in your car, you can simply go to the public health department and just do the drive-through. So we called there, no appointments necessary. We were able to go straight to the public health department. No wait. It was very convenient, and they swabbed both of us. We both had a nasal swab. There's two types of tests, and I'm not, actually probably three if you consider the rapid test, but I'm not familiar with that. The nasal swab is a shorter Q-tip-like swab. It's not made of cotton. The swabs are foam or polyester or nylon, I understand. And they can be just simply swabbed. Some places have you do a self-swab, but they actually help do it through our window of our car. And then they put that swab into a test tube-like container that is just saline filled and send it off for study. That was on Friday, May 22nd. Well, Sunday, guess what? I started having symptoms. So my symptoms presented like Jim's, with a dry cough and a fever. Jim said to me on Thursday, he said, I just don't feel well. I just don't feel good. And I'm like, oh, here we go. And he only had a fever of about 99.6 that day. My fever presented on at 99.1, low grade. So what I recommend as your first tool is a good old thermometer. If you don't have one at home, you can find them. They're starting to come back into the stores. This I just got at Walmart. Order it online from Amazon. But start taking your temperature every day, just so you have a baseline. I do it every day for work, so I know that mine runs relatively low in the 97 point something range. So when mine was 99.1, I knew that was a fever for me. But the fever defined in the clinical journals is 100.4, which should have been higher for me. So I think take your temperature. I actually, the moment I started having symptoms, had to start filling out a log, which I recommend as a second tool. You can see I kept it for a solid month, twice a day, with not only a recording of my temps, but any symptoms. That was a work requirement, and it's following guidelines from our public health department. So that was actually, it's been really helpful because so many people have asked me questions. I've been able to refer back to this tool and look at when things started and when things stopped. But the fever lasted for both of us, and we followed a pretty similar course. I have a feeling that Jim's was milder than mine because he'd had less exposure time to the person who infected him. But we had fever for about 3 to 4 days, on and off. And when the fever spikes, the lethargy comes. So you get lethargic, fatigue, malaise. You just like, and this is where people want to compare it to the regular flu. You just want to lay in bed and sleep and not do anything. Along with that, I had no appetite, which was not a bad thing for me, but I absolutely just did not want anything. There was nothing that appealed to me. I was totally fine. And anytime I started to drink, I began to have GI symptoms. So you can have associated symptoms, the most common being fever in 88% cases, dry cough in 68% of cases, the fatigue and malaise in 38% of cases. Some people also report headache. I never had that. Jim never had that. Sore throat, never had that. Myalgia, joint pain, I did have a bit of that. Again, sort of like a flu-like syndrome. But the GI symptoms are sort of new and different for this virus. And that includes abdominal pain, diarrhea, or loose stools, nausea, and vomiting. So happens, coincidentally, not related to my case at all or my husband's, my best friend and her husband have just recovered from COVID in their home. And she had, I would say, a mild plus to borderline moderate case of COVID. But the biggest difference for her as compared to me, is she had nausea for 8 days nonstop. And so she was on Zofran, an antiemetic, anti-nausea medicine, which I think would be absolutely miserable. I didn't have that, but I did have some loose stools, and I know that's TMI, too much info, but it goes along with it. Why? People want to know why. And we've got some doctors in the group out there who can probably tell more than me, but you got these ACE receptors along the lining of your mucosal tracts to your respiratory tract as well as your GI tract. And the virus, those little tiny projections that you see as it's depicted in the news, flashed up there, that's like the key, and it wants to find the lock. And those receptors in our back of our throat, in our respiratory tract, down to our air sacs called alveoli, and down through our GI tract are all susceptible to the virus. And so you have the associated symptoms there.
It's doing funny.
Actually, I didn't have any severe GI symptoms. And I also did not have any severe respiratory symptoms, but my friend had intense chest pressure and a little bit of shortness of breath. So the next tool I recommend is a pulse ox. Pulse oximeter. This is your indicator of your measure of our blood, your oxygenation in your bloodstream. And it should register at 95% approximately to 99%. You want it to read. And this is going to tell you if you're starting to have respiratory distress and if you're not getting oxygenated, if your tissues are not getting oxygenated, which is the major side effect from this virus that leads to the severe symptoms that result in, like our friend Gerald, ventilator support and hospitalizations and ICU stays. Fortunately, I didn't go anywhere near that, but I will tell you that one of the things that I think any of us who have the mild case have is that we sometimes lie there, especially when you're not feeling good at all and you're sitting there, you're going, am I breathing okay? Do I feel short of breath? You start questioning how you're feeling, and it's a bit fearful. One of the other things that I was told that is true is that you might have these mild symptoms at the beginning, but around day 5, day 6, you can have what's called an exacerbation or flare up. And that might be when these symptoms start presenting themselves. So it is wise to just keep track of that. And that indeed is exactly when Jim and I both literally on the same day at the same time, we were sitting and we finally felt like eating a meal together, looked at each other and said, can you taste this? I can't taste it at all. It's delicious steak. We made something nice to eat because we hadn't eaten in a while, and we couldn't taste it at all. It was like rubber. Actually, it was very tender. I take that back. But it was tasteless, and that we lost our taste and smell. So actually, what it is you lose your sense of smell, which those nerve endings in the back of your nasopharyngeal area are very close to the area where the virus settles, and it kind of gets inflamed, and it affects, they say, possibly the nerve there that helps you to smell, and that affects your taste. So you don't lose the taste, the sense of salt or the sense of sweet or bitter, but you just don't have the flavor. It's hard to describe. It's a very strange symptom, and it's very unique to this virus. And it happened to both of us on the same day, reporting it at the same time about that period of time, a week into our recovery. I don't want to dwell any more on symptoms because you guys have been hearing the news so much, but self-isolation, when Jim went upstairs, he basically just hung out there. I was, for a couple days when he was at his worst, not symptomatic yet. So I was able to take food up, kind of leave it on a tray by the door, tap on the door. I put my N95 mask. I was really hoping I wasn't going to get this virus. Put it on and kind of shove it through the door. And he hung out up there. He didn't like it. It was lonely. He doesn't like working from home, but it was necessary. And fortunately, I was able to help him through his roughest times. But basically, there's no treatment for this virus other than symptom control. So, you know, you're talking Tylenol or ibuprofen around the clock for fever and joint pain. And if you do get any of these more reportable symptoms that are progressive, you know, if that dry cough progressed to shortness of breath, then you would see a physician and there might be some symptom control medication for that. But good old bed rest fluids and medication for fever is what they're saying and what they're recommending. The testing, I want to tell you that I went back after I was symptomatic the following week, Wednesday. You know, remember that we went for a test on Friday at the health department. Those test results did not come back till Wednesday, May 27th. And that's pretty much the norm. It's been about 5 to 6 days for testing to return. And Jim's test came back positive and mine came back negative, my first test. But I, by that time, was already symptomatic. So I called my work-related physician and he said to come in on Friday, May 29th. That was the Friday after Memorial Day. And I went in and had the long swab test. So I had both the nasal smear, the nasal swab, and the long one, the one they say goes all the way back to your brain. And basically that's that long swab that they go right up through the nasal septum to your nasal pharyngeal area, and then they twist it around a little bit. It is not comfortable. It is quick, but it's to get to that tissue where that virus is most likely to start settling. And that did come back. That test was on Friday, and he called me on Sunday and said it was positive. So there are different tests out there, different time frames, and the timing of the testing can really kind of affect things. So because my first test was negative, I was asymptomatic when I had it. I didn't have symptoms yet. I might have not had enough viral load or, you know, enough virus shedding in my body to make that test positive. But by the time, obviously, that I was, the second test came back. So that's, you know, a lot of people, it's concerning, may have a negative test and may have no symptoms, but may have this virus. And so if there's doubt, get tested again, I recommend. My work guidelines are a little bit more conservative than the CDC. So what happened for me was I was on quarantine after reporting a positive, actually symptoms, and then positive test for 14 days. I think the CDC now says 10 days, with the last 3 days or 72 hours being symptom-free. And that was my work. CDC says last 72 hours fever-free. So CDC guidelines is 10 days post first symptoms with the last 3 days being no fever. And then you can go back to work. I was working from home already, and so I just was very conservative and just stayed here and didn't have any interaction with people face to face to save them and me from the worry that I might still be shedding the virus. I will say the dry cough that I had kind of persisted and lingered, and I did record that, and that made it go beyond that 14 days. So I felt more comfortable interacting electronically and by Zoom and such with people during that time, rather than trying to just self-say that I was, you know, not infectious anymore. But I'm back to normal for, you know, what normal is these days, feeling good, and a few pounds lighter from 2 weeks of not eating, but that's easy to put back on. I'm trying really hard not to. My friend is recovering, the one I mentioned, and I'm still taking precautions. I'm doing everything that I was doing before because I understand there's a possibility I might have resistance, but I might not have immunity. We don't know that yet. People have asked if I'm going to take the antibody test. and I do have an appointment for a regular physical with my physician, and I'm going to ask about it then. Because if I can donate convalescent plasma for someone's help, I would like to do that. I'm not sure what the studies are saying about that, but that's a question that might come up. Any questions at all? That's pretty much my experience, and I do hope for all of you out there that you save yourself from the worry of the experience that you see on TV. Knowing that the majority of us can recover at home. I will say I don't have any of those comorbidities. I'm fairly healthy. So if you do, just be very extra precautious. No heart disease, no diabetes. So got the age on me. It's, I'm not spring chicken anymore. So I'm aware of that. But fortunately, I was able to get over this mild case, and I hope for any of you that might be exposed that you do too. Of course, I hope that you don't get it at all. Any questions that I can answer for you?
Julie, this is John Nelson.
Sure.
Can you just review the time schedule again in terms of when you came down with it, how long did it last, and then how long did you have to isolate yourself after that?
So let me just put it in the context of some generality. I actually was symptomatic on the Sunday night before Memorial Day Monday. I had already had a test on Friday that came back that following Wednesday negative. But I called my doctor after that test came back negative and was retested. So I was positive. That I would say you're pretty down for 2 weeks. The first week you're feverish. I was feverish for about 4 days straight. Then I had a really good day. In fact, I had a Zoom meeting that day with work, and none of my coworkers knew I was sick at all. I felt really good, but that next day I bottomed out. Fever came back. So it's the first week it's up and down with your temperature. The second week you might not have a fever, but you have this fatigue and that overwhelming fatigue. And I still had that dry cough. So a good 2 solid weeks of symptoms, and you may have more than that. I had the GI symptoms along with that. Anything I took in, I would have to run to the restroom. And my friend, like I said, had nausea for 8 straight days. The next 2 weeks after that was a little bit up and down, but less fatigue, lingering cough. So I'm going to say a good solid 3 weeks to a month of, if you want complete recovery for someone that has a very mild case like I did. And that's, not having any of the possible other strange symptoms you can have. Now, my loss of taste and smell kicked in a week after my first symptoms. So I became symptomatic a week before I lost that sense of smell, and that took probably 2 weeks to come back. That was strange. That was slow recovery. And Jim and I had a few strong smelling things around the house that we kind of were testing ourselves with. And he'd say, "Can you smell this?" And I'm like, "No." He goes, "I can't either." And then I started to get it back before him. So that's very individualized. And I have full recovery of that right now.
Yeah, one final question. After that is all over and you're fully recovered, is there any isolation required?
No. So the big thing now is, how infectious are you for how long? And that 14-day window, the incubation time for the virus is 2 days to 14 days. That's the time that the virus can grow. So you want that 14 days of isolation for sure, which is why I said my employer had me fill out this log. And if it had been normal times and we could be going into the office, I would be working from home then, or on sick days until I could work from home.
Sure.
The self-isolation, different from what I was saying about the 14 days, was when I sent him upstairs, was when he became symptomatic, but we didn't have the test results back. We didn't know if he was positive or negative. We assumed he was positive, so I sent him upstairs with the assumption that he was positive.
Of
Then
course.
when I got symptoms that following Sunday, so he got symptomatic Thursday. When I got symptoms Sunday, I'm like, okay, there's really sort of no reason that he has to be up there and I can be down here. We can be isolated together. But I did check with my doctor about that, and he said, sure, he could come down. But if I hadn't been symptomatic, he would have been isolated up there for 14 days.
Right.
Julie, I have a question. This is
Assuming
Catherine.
he didn't have a fever. Assuming he didn't have a fever for that last 3 days. Yes, Catherine.
Thank you so much for sharing
Sure.
that with us. It's really, really helpful. So I have a friend, and I'm going to ask a question based on his experience that I just heard about on Saturday, as to whether it makes sense that if you have some vulnerability in your body, let's say your heart is weak or let's pick some.
COPD for the lungs. Right.
Yes, well, he had an attack of his gallbladder. He had never had any gallbladder problems before. He actually presented very suddenly with lots and lots of abdominal pain, was at the hospital getting an ultrasound of his abdomen when his gallbladder burst.
Oh, wow.
And all of the bile affected all of his other organs, had gangrene. 2 weeks later, he was better, and then eventually had his gallbladder removed. But my question relates to, that's one of those strange stories that you hear about. Does it make sense that a vulnerability in your body might be more susceptible to be attacked, or that you might be more vulnerable because of some weakness? What do you know about that?
Well, I mean, I think they're talking about that, and my doctor friends out there, healthcare friends, chime in, or anyone who's done reading, because I've been doing a lot of reading about this. I mean, any of us who have a weakness in our immune system are more vulnerable. Any of us who have some of these pre-diagnosed disease processes like heart disease, lung disease like emphysema, COPD, diabetes, obesity is a huge issue, are inclined. The inclination is that they're already weakened, and their body is already weakened by that disorder, and they're more vulnerable. People with autoimmune diseases, people on chemotherapy who are immunocompromised, their body is just more susceptible.
Mm-hmm.
So I think if this gentleman was ill, leading to a rupture, who knows? We don't know. He might have been more susceptible. Did he become a COVID patient?
Oh, yes. He lives in New York, is an executive chef, does all of the preparation of meals for 26 hospitals in the system, and had some exposure at one of the hospitals most probably, but he'd never had any very fit, never had any other health.
So that was after the surgery?
Oh no, the surgery was much later, after he was released from the hospital, after he had a chance to drain, to heal. Then they brought him back in and removed his gallbladder, but not at that point.
Yeah. That would be a physician question that I would defer to my medical friends to answer, but I would think that the COVID is obviously going to wear him down if he had any inclination at all towards another illness,
Mm-hmm.
just like the opposite. You're
Yeah.
inclined.
Yeah, thanks.
Hey, Julie.
Yeah. Hey.
Did I understand you to say that the man who infected your husband had gone to Walmart without a mask?
He did.
And so he thinks that's where he picked it up.
That's where he thinks he picked it up, and that would be called community acquired. So I did mention, I didn't mention that what happens is after you get tested, and in my case, it was at the health department, and so I was informed by the staff there. But if I'd been at the urgent care or even my own physician, they report those statistics to a central location. You're going to be on a list and you'll be called. So the health department staff called me to report my results, because I did have the testing originally there, but also to do some questions, to ask me questions. They call that contact tracing. And basically they want to try to go back and find out everyone that you could have possibly been around that might have infected you, or that you might have infected subsequent to your positive test.
Did anybody else in his office, were any of the other workers in his office infected by him? And what did they do? Was everyone then put on self-quarantine after he tested positive, or how did that go?
So work policy. Yeah, work policy put the people who he worked immediately around on quarantine for the number of days per their policy. I can't remember what that was. That's where my husband works. So they went to great lengths to make sure that coworkers were safe. That gentleman, because of the blessing of timing, him being symptomatic over the weekend and not working, thankfully didn't expose a lot more people than he did. But there was one other person affected, yes, who was ill.
Okay.
And I told Jim, I said, if this had happened back in March when we went down lockdown, his employer would have been on the headline as an outbreak. But because it was already May, it wasn't as big an issue. It was more quiet. But thankfully, there weren't any other cases there.
Okay.
But they'll come. The health department calls you. They want to go back. In his case, he shared with them, I have been known to go to Walmart. I can't stay home. I get restless. Don't wear a mask. And so I ask of you all, when the chances of you getting are greater from airborne disease than from contact. But if you go grocery shopping and you stand there and you contemplate one brand over another, don't pick it up and put it back if you choose the other brand, because someone's going to come right after you and pick that can up, and that virus could be on that can. My son's a second-year resident at the University of Kentucky, and was in the COVID ICU for a month. And he had a number of people who died under his watch, sadly. 3 of them in one night died, and the only thing they have in common is that they had gone grocery shopping at the local Kroger. And that was where they felt that they probably were infected. And they had been just diligent about staying home otherwise. They went out for groceries. So when you go out for groceries, guys, be careful. That's a long-winded answer to your question. Yeah. Anybody else?
Julie, Paul Caprosi.
Yeah.
Question for you. Can you recall whether or not Jim, when he had his test, did they use the long nasal swab?
They used the short one. And his was positive, and he was symptomatic. Okay. I had the short one. This was at the health department. And that one was negative. Now, I was not symptomatic. I did not have symptoms yet.
I just wondered if there was a false negative just because of technique, because obviously. I
agree. I wondered too, but because I've been with him, all week. He obviously had been exposed the prior Friday, so I would have assumed that I would have been exposed by then, and it would have come back positive, even though I wasn't symptomatic yet. But it didn't. So was that a false negative, or was that because I didn't have viral load? I don't know.
Prior to my back surgery in Charlotte, they required me to have a COVID test, and I was not given an option. I had the long probe. It was not that big a deal, but I mean, it was still no option. And I think it's probably a better test, quite frankly. I haven't numbers, but
that was a test they used in China that we were short of. I've done a lot of reading, and so the FDA, worked hard and quickly to come up with another alternative, because we were short of the long swab tests. and they came up with the short swab test. And the agent, I think that they put the long swab in was possibly the item 2 that we were short of. I agree. I don't know that it's the short swab is good. But that's my opinion. It's
Yeah. No,
based
I,
on science or evidence.
sure.
Yeah.
Great
It
program.
certainly makes more sense to me because it goes all the way back to where the virus has settled in your nasopharynx, in the tissue where it is.
Exactly.
And that happens to be the night that I got the no taste, no smell. And I'm like, did that test stir up that virus? I mean, I don't know. It seemed like it did.
Yep.
Yeah. Anyway, do you want to correct or fix anything I said, doctor? Because I'm okay.
No, you did a great job. Thank you.
Yeah.
Yeah. So everybody stay healthy. I'm glad you're feeling better, Paul. And take care and continue to be diligent. And I have been reading. In fact, I meant to hold it up. I've been reading a great book called The Great Influenza, which talks about the 1918 Spanish flu. If any of you are interested, you might be over and done with this COVID infectious disease stuff, but it is so telling. It's so interesting. And it's frightening because it's almost like history's repeating itself right now. And the biggest factoid about that Spanish flu is it's had no origins in Spain at all. It had origins in a small rural county in Kansas, believe it or not. Then went to the military bases that then took it to Europe with World War I. But there's your trivia for the day.
Thank you.
Thank you.
Well, you would have been on my prayer list if I would have known about it.
Thank you,
Glad
Bill.
you're doing
I
good.
actually was quite private about it because I didn't want anyone in the community to think that we might have had an outbreak at hospice where I work at Carolina Caring. As of today, I think I'm the only employee that's had the virus. And we've been taking care of patients with it, or in places like congregate living facilities that have other patients who have it. And fortunately, no one's gotten sick on our staff other than me. And mine wasn't because of work at all. It was because of Jim's work. So I kept kind of quiet because of that. But I'm not anymore because I'm way out now and totally fine. So.
Great.
Julie, can I ask you another question? The Exodus Homes residents, we have 73 people, and we allow them to go grocery shopping once a week to Walmart. And we have several loads that go yet and still everyone does go grocery shopping once a week. We do require them to wear masks, but beyond that, what can you do? Because I heard you say that those 3 people who died, the only thing they had in common was going to the same grocery store. Were they wearing masks?
And that might have been, and what I don't know that from Will. I don't know if they had masks. And the big thing is the masks, not only are they good for obviously covering your airway and your mouth, but they help to prevent you touching it. So it could be that those people did not have masks on, and I don't know that, and may have touched their mouth afterwards, after touching another item, or they might have been in just not socially distancing in the store. I know I haven't been to Walmart lately. I don't know if anyone has in the club, but I know the last time I went, they were more diligent. I think they've cracked down about everyone having to wear masks now. And they had someone stationed on the outside counting how many people went into the store. And the time that I went in, I was like, wow, this is the best shopping I've ever done in here because there's not all these people packed in here. And they had the arrows so that people were keeping, socially distant. So it might be a better situation now than when my son's patients went shopping. So,
well, I know when I went last weekend,
is wash their hands. I mean,
Yeah.
if they don't touch their face and their mouth and their nose and their eyes, and wash their hands after they, leave the store.
I know last weekend I went and there were still people being let in with no mask. I just couldn't believe it. Even though they've got big signs outside, everyone has to wear one. I know the associates don't want to get in an argument with folks about it, but they're
And
supposed to.
I totally get why they want to go there. The prices are less expensive and it's convenient. They can do one-stop shop, so they just need to be just diligent. Wear their masks. If they touch anything, don't touch their face and eyes and nose. Wash their hands.
Yeah.
The three things.
Okay.
Socially, yeah. Just keep reminding them.
Well, Julie, this is
Definitely.
Lou. Thank you for a really informative program. This whole COVID thing can be very, very scary, but I'm sure glad that you and your husband got through it okay with no big problems. That's great. And I hope you continue to do so, and I hope all of us stay safe. But again, thank you for a very informative program. We appreciate it.
Thank you.
Next week, we're going to have David Haas's program. The young man is named Wes Parlier, and he is a United Airlines pilot. And he's going to talk to us about what COVID-19 has done to the airline industry and to flight scheduling. And also next week, David Hood is going to give the invitation. So unless there is something else that we need to talk about for the good of the club, we will close with the four-way test. Is it the truth? Fair to all
They're
concerned?
all concerned.
Will it build goodwill and
Build
better
goodwill and
friendship?
better friendship.
Friendships
Will it be
benefit
Be beneficial to all concerned.
Thank all of y'all for joining us, and we'll look forward to seeing you next week.
Thank
Have
you.
a good week.
Thank you.
Bye.
Bye.
Thanks, Julie.
Thank you.
Bye,
I'm glad